Did you know that most people believe brain tumors are a death sentence? That's a lie. Here's something even more shocking. 70% of brain tumors are actually benign. They're not cancer. They don't spread. And yet millions of people are living in fear because of myths they've heard online, from friends, or even from outdated medical advice. So why do neurologists rarely panic when they hear the words brain tumor? Because they know the truth. And today, I'm going to share that truth with you. What if everything you thought you knew about brain tumors was wrong? What if the fear you're carrying right now is based on fiction, not facts? Stay with me, because by the end of this video, you'll understand what's real, what's Hollywood drama, and what you can actually do to protect yourself. Hi, I'm Dr. Michael Harrison, board-certified neurologist here in the United States, and I've spent over 15 years working with brain tumor patients from diagnosis to recovery. I've seen the fear in people's eyes when they hear those two words. I've also seen the relief when they learn the truth, and that's exactly why I'm making this video. To cut through the noise, to give you science, not speculation. But before we dive in, do me a favor, hit that like button right now. It tells YouTube to share this video with more people who need it. Then subscribe and ring the bell so you never miss life-saving content like this. And drop a comment below. Tell me which myth you've heard before. I read every single one. Now, let's talk about something serious. Something that could change how you think about your health forever. Asterisk, let me tell you about Sarah. Sarah was 42 years old, mother of two, working full-time as a teacher. One day, she started getting headaches. Not terrible ones. Just annoying. The kind you ignore because life is busy. Then she Googled it. Headache that won't go away. The first result. Brain tumor? She panicked. She spent 3 nights reading horror stories online. She convinced herself she had 6 months to live. She couldn't sleep. She couldn't eat. She stopped playing with her kids because she thought, what's the point? Finally, her husband dragged her to the doctor. They did an MRI, and you know what they found? Nothing. No tumor. Just tension headaches from stress. But those 3 weeks of terror, they nearly destroyed her mental health. Why? Because she believed a myth. And here's the truth. Sarah is not alone. Millions of people are walking around with unnecessary fear because they don't know what's real and what's fiction. So, let's fix that. Right now, asterisk myth number 1. All brain tumors are cancerous. This is the big one. The myth that causes the most fear. And it's completely false. Here's the truth. About 70% of brain tumors are benign. That means they're not cancer. They don't spread to other parts of your body. They grow slowly. Sometimes so slowly, they never cause problems at all. Let me explain this, like you're looking at a garden. A benign tumor is like a weed that grows in one spot. It might get bigger, but it stays put. A cancerous tumor? That's like a vine that spreads everywhere, choking out everything in its path. Now, does that mean benign tumors are harmless? Not always. Because here's the thing. Your brain is packed inside your skull. There's no extra room. So even a benign tumor can cause problems if it presses on important areas. But here's what you need to remember. Benign does not mean malignant. Most brain tumors can be watched, managed, or removed without the nightmare scenarios you've seen in movies. Your action step. Stop assuming the worst. If you're worried about symptoms, see a doctor. Get facts, not fear. Asterisk myth number 2. Cell phones cause brain tumors. Let me guess you've heard this one, right? Don't hold your phone to your head. You'll get brain cancer. Here's the science. There is no proven link between cell phone use and brain tumors. None. Zero. Zip. I know that sounds shocking, especially with how often you hear this myth. But let me break it down. Cell phones emit radio frequency radiation. It's ionizing radiation, which means it doesn't have enough energy to damage your DNA. Think of it like this. The sun emits ionizing radiation UV rays, which can cause cancer. That's why you wear sunscreen. But your phone? It's more like a warm light bulb. It gives off energy, but not the dangerous kind. Now, have there been studies? Absolutely. Big ones. The World Health Organization reviewed decades of research. The American Cancer Society did the same. And the conclusion? No consistent evidence that cell phones cause brain tumors, but here's what I will say. We don't have 50 years of data yet. Cell phones are still relatively new. So if you're worried, use a headset. Use speakerphone. That's fine. But don't lose sleep over this myth. Your action step. Stop panicking about your phone. Focus on real risk factors instead, like the ones we'll cover next. Myth number 3. Brain tumors always cause severe symptoms. This one is dangerous because people think, I feel fine, so I'm fine. And that's not always true. Here's the reality. Many brain tumors cause no symptoms at all. Especially in the early stages, they're discovered by accident during an MRI for something else, or after a minor head injury. And when symptoms do appear, they're often subtle, not the dramatic Hollywood version where someone collapses and has a seizure. We're talking about things like mild headaches, slight vision changes, a little dizziness, forgetting words more often. Let me give you an analogy. Imagine your car engine has a tiny leak. At first, you don't notice. The car runs fine, but over months, that leak gets bigger. The engine starts making noise, and by the time you take it to the mechanic, the damage is worse than it needed to be. Your brain works the same way. A small tumor might not cause obvious problems at first, but as it grows, it starts pressing on nerves, blood vessels, or brain tissue. And that's when symptoms appear. So what are the symptoms to watch for? Headaches that change pattern, maybe they're worse in the morning. Vision problems, blurry or double vision. Balance issues, seizures, personality changes, weakness on one side of your body. But here's the key. These symptoms don't automatically mean brain tumor. They could be 100 other things. That's why you need a doctor, not Google. Your action step. Don't ignore persistent, unusual symptoms. Get checked. Early detection saves lives. Myth number 4. Brain tumors are always genetic. People ask me this all the time, Doc. Does brain cancer run in families? My uncle had one. Am I next? Here's the truth. Most brain tumors are not inherited. The vast majority happen randomly. No family history. No genetic curse. Just bad luck now. Are there genetic conditions that increase risk? Yes, but they're rare. We're talking about conditions like neurofibromatosis, Leigh-Fromeny syndrome, or Lynch syndrome. If you have one of these, your doctor already knows. You're already being monitored for everyone else. Your risk is about the same as anyone else's. Having a family member with a brain tumor doesn't doom you. Think of it like lightning. Yes, lightning can strike the same family twice, but that doesn't mean it's genetic. It's random chance. Here's what actually matters more than genetics: environmental factors and lifestyle. Things like exposure to high-dose radiation, like from radiation therapy for another cancer, certain chemical exposures, and possibly a weakened immune system. But even then, your overall risk is still low. Brain tumors are rare. In the US, about 24,000 people are diagnosed with malignant brain tumors each year. Sounds like a lot, right? But out of a population of 330 million, that's about 0.007%, your action step: stop blaming your genes. Focus on what you can control, reducing unnecessary radiation, living healthy, and staying informed. Myth number 5, surgery for brain. Tumors always causes permanent damage. This is the myth that keeps people from getting treatment. They think, if I have surgery, I'll lose my memory. I'll lose my personality. I won't be me anymore. I get it. The brain is delicate. Surgery sounds terrifying. But here's the truth. Modern brain surgery is incredibly precise. We're not talking about the dark ages anymore. Surgeons today use advanced imaging MRI, CT scans, even intraoperative MRI, which means they can see your brain in real time during surgery. They use tools that map out which areas control speech, movement, and memory before they cut. Think of it like a GPS system. Before GPS, you'd get lost all the time, right? Now, you know exactly where you're going. Brain surgery is the same. We know exactly where we're cutting. We avoid the critical areas. And here's something amazing. The brain can adapt. Even if a small area is affected, other parts of your brain can often take over that function. It's called neuroplasticity. Your brain is tougher than you think. Now, are there risks? Of course, every surgery has risks. But the risk of not treating a growing tumor is often it's much worse. I've seen patients walk into surgery terrified and walk out days later, talking, laughing, and relieved. I've seen people go back to work, back to their families, back to their lives. Your action step. Don't let fear of surgery stop you from getting treatment. Talk to a neurosurgeon. Ask questions. Understand the risks and benefits. You have more options than you think. Myth number 6. Brain tumors only happen to older people. Wrong. Brain tumors can happen at any age. Children, teenagers, young adults, middle-aged folks, seniors. No one is immune, in fact. Brain tumors are the most common solid cancer in children under 14. Let that sink in. Kids, not just grandparents, and different types of tumors happen at different ages. For example, medulloblastomas are more common in children. Glioblastomas, the most aggressive type, tend to appear in adults over 50. But there are exceptions to every rule. So why does this myth exist? Because people assume cancer is an old person's disease. While it's true that cancer risk increases with age, brain tumors don't follow that pattern as strictly. Here's the takeaway. Age is not a shield. If you're experiencing symptoms, don't brush them off just because you're young. And if your child is having unexplained headaches, vision problems, or balance issues, don't assume it's nothing. I've treated 25-year-olds with brain tumors. I've treated 8-year-olds. I've treated 70-year-olds. Cancer doesn't care about your age. Your action step. Take symptoms seriously at any age. Don't assume you're too young for something serious. Myth number 7. There's nothing you can do to prevent brain tumors. This is the myth that makes people feel helpless. It's random. It's genetic. There's nothing I can do. But here's the truth. While you can't prevent every brain tumor, you can reduce your risk. And you can absolutely take control of your brain health. First, avoid unnecessary radiation exposure. That means don't get CT scans or X-rays unless you really need them. Medical radiation is safe in small doses, but it adds up over time. Second, protect your head. Traumatic brain injuries have been linked to a higher risk of brain tumors later in life. Wear a helmet when you bike, ski, or skateboard. Wear your seatbelt. Prevent falls at home. Third, live a healthy lifestyle. There's no magic food that prevents brain tumors, but a healthy body supports a healthy brain. Eat whole foods, fruits, vegetables, lean proteins. Stay active. Manage stress. Get enough sleep. Fourth, avoid smoking and excessive alcohol. While these aren't direct causes of brain tumors, they weaken your overall health and immune system. And finally, stay informed and get regular checkups. If you have symptoms, don't ignore them. Early detection is everything. Think of your brain like a castle. You can't stop every invader, but you can build strong walls. You can have guards. You can be prepared. Your action step. Start today. One healthy choice. One protective habit. You have more power than you think. All right, let's do a quick recap, because this is important. Myth number 1, not all brain tumors are cancerous. Most are benign. Myth number 2, cell phones don't cause brain tumors. Stop worrying about that. Myth number 3, brain tumors don't always cause severe symptoms. Pay attention to subtle changes. Myth number 4, brain tumors are rarely genetic. You're not doomed by your family tree. Myth number 5, brain surgery is safer and more precise than ever. Don't let fear stop you. Myth number 6, brain tumors can happen at any age. Don't assume you're too young. Myth number 7, you can take steps to reduce your risk and protect your brain health. Here's the bottom line. Knowledge is power. Fear thrives in darkness. But when you shine a light on the truth, fear loses its grip. You are not helpless. You are not a victim. You have control over how you respond to symptoms, how you take care of your brain, and how you live your life. Don't let myths steal your peace. Don't let misinformation control your decisions. You've got this. All right, friends. If this video helped you, do me a huge favor. Hit that like button. Share this with someone who needs to hear it. Because this information could literally save a life. It could save someone from unnecessary fear. It could push someone to see a doctor who's been putting it off. And if you haven't already, subscribe to this channel. Ring the bell. Because I'm here every week breaking down medical myths, giving you real science, and helping you take control of your health. Thank you so much for being here. Thank you for trusting me with your health. And remember, you are stronger, smarter, and more capable than you think. Take care of that amazing brain of yours. I'm Dr. Michael Harrison, and I'll see you in the next video. Stay healthy, stay informed, and stay fearless.